Very good morning, everybody. So, today we'll be concluding with the topic on survey procedures in dentistry and a quick recap of what we have discussed in the last two classes. We started with what is the definition of a survey. It is a non-experimental investigation. What are the different types of survey? How do you classify it based on various headings? Then an explanation regarding that. Then what is sampling? And what are the terminologies related to sampling, what are the types of sampling broadly classified as probability and non-probability methods, then about each type of probability and non-probability sampling in detail. Then next was what are the 7 essential steps in conducting a survey. We started with these steps: establishing an objective, designing the investigation, selecting the sample, collection of data. In that we discussed about validity and reliability of data and what are the different types of examinations. Then what is standardization and calibration? What are the essential elements of drafting a questionnaire survey? And then coming to analyzing the data, drawing the conclusion and publishing the results. So these are the 7 essential steps in conduct of a survey. And today's topic is about the WHO index age groups. Now what is this? This is a very important short note, WHO index age groups. Now what does this mean? The World Health Organization has recommended that if at all you study the oral health, they have recommended 5 age groups to study the effects. One is 5 years, 12 years, 15 years, 35 to 44 and 65 to 74. Now why such a standardization is necessary is because only then you can compare. There will be uniformity. That is, if everywhere these 5 age groups, the studies are conducted to assess oral health, you can compare between different countries. So in order to ensure uniformity and enable comparison, WHO has recommended that preferably you can conduct any oral health related survey, okay, in these 5 age groups. So we have 1 age group for the deciduous dentition and 4 age groups for the permanent dentition. So for deciduous dentition it is 5 years, for permanent dentition it is 12 years, 15 years, 35 to 44 years and 65 to 74 years. Now why these age groups are special, or why are these age groups called as index age groups? I'll tell you the reasons. The first deciduous index age group is 5 years. Now for deciduous dentition, 5 years is a time by which all the deciduous teeth would have erupted and there will be sufficient exposure of about at least 2 to 2.5 years for the last erupted tooth. That is, by around 2.5 years all the deciduous teeth would have erupted, and for a disease like caries, it is not something that happens immediately. It takes time. It is all a chronic disease. So the rest 2 to 2.5 years is an exposure time to study dental caries. So the reason 5 years is selected is because at the age of 5 years, all deciduous teeth would have erupted and there will be sufficient exposure of the teeth in the oral environment for developing the chronic disease. And the second reason is 5 years is the age at which in most of the countries children join school. And what is the importance of that here is, if you want a study for where children are the samples, the best method is go to a school rather than go to each house and inquire. The easier way to collect data is through schools. So 5 years is the age at which children usually are already in schools, and it is easy for you to collect data from the schools. That is why it is called as an index age group for the deciduous dentition. For 2 reasons. One is children usually do join the school at this age. It is easy to collect the school-based data. And second is, at this age group, all deciduous teeth would have erupted and there will be sufficient exposure in the oral environment. Now next is 12 years. 12 years is important because it is the age at which children leave the primary school and all teeth except third molars would have erupted. And if you look at this, usually primary education, almost all children undergo primary education. It is easy to collect the data based on primary education at this age group. And this is all teeth except third molars would have erupted. And this age is known as the global monitoring age for dental caries. 12 years is known as the global monitoring age for dental caries. An important viva question. Next is 15 years. By 15 years, all the permanent teeth would have erupted except third molars, and there will be sufficient exposure in the oral environment to develop these diseases. And caries becomes more meaningful beyond 12 years because for the especially second molars, there will be sufficient exposure of 2 to 3 years. And this is an important age group for assessment of periodontal disease conditions among adolescents. So these are the reasons why 15 years is considered as a index age group. The fourth index age group is a range that is between 35 years to 44 years by a mean of 40 years. So we can conduct the study between 35 to 44 years. And this is a standard age group for measuring the health condition in adults, because the full effect of dental caries, periodontal disease, gingival diseases, wasting diseases, all this you can get to know whenever you talk about 35 to 44-year-old. So this is the standard age group for measuring the oral health conditions in the adults. The cumulative effect of oral health conditions can be assessed in this age group in the adult population. The last age group is 65 to 74 years and with a mean of 70 years. This age group is recommended to study geriatric oral health. Geriatric is the oral health care of elderly. Okay, so it could be dentulousness and it could be the problems faced by geriatric population. The ideal age group to study this is 65 to 74 years. It was a recently added age group. Initially, this was not there. So in total, there are 5 different age groups recommended by WHO which can be used to study oral health conditions. And this recommendation is again to ensure uniformity as well as to enable comparison with among different countries. So the 5 age groups are 5 years, 12 years, 15 years, 35 to 44 years and 65 to 74 years. This can be asked as a short note question. Next, WHO has also recommended a survey known as Basic Oral Health Survey. Now, what is this Basic Oral Health Survey? That is, it is a survey method to collect basic information about oral health status and treatment needs of a population. So, likewise, I told you for index age groups, WHO has given us proforma. Okay, if you stick on to that proforma and record all the things in that proforma, everybody will be recording uniformly, and that will enable comparison among population and will enable a standardization or uniformity. That is why a basic oral survey is a survey used to collect information about oral health status and treatment need of a population, and hence you can monitor the changes or compare the changes across the populations. So the uses of basic oral survey is, first you can know which are the existing oral health services, whether they are apt for the population. Then what is the nature of preventive, curative and restorative work required? What are the resources required to establish, maintain, expand or reduce the oral health care need? Okay. Or next is, you can know the overall prevalence of the conditions affecting and how the disease varies across ages, how the disease varies across population, what are the various treatment needs. All this you get to assess when you record the basic oral health survey. So there are 2 types of basic oral survey. One is called the pilot survey, the other is called the national pathfinder survey. So usually before going to a national pathfinder survey, a pilot survey is conducted. Pilot study is a study which is conducted before the main study to know if at all any changes are required, if at all any modifications are required. This is all assessed with the pilot study. Pilot study is done on a small sample just to see how practical is your approach. Is there any major changes required? Because unnecessarily spending all the resources on the main study and then getting a bias before that or getting into trouble once you are directly going to main study. To avoid that, you are all doing it on a small study first. That small study is like it tells you what all changes are necessary at that level itself, so that you can incorporate that in the main study. So pilot study includes only 1 or 2 index age groups, whereas National Pathfinder Survey includes all the important age groups. So at least 3 or more age groups are included in the National Pathfinder Survey. So usually a pilot study is done before the main study to check the feasibility, to check the to know if any modifications are necessary. So these are 2 types of basic oral survey. So the sampling method used in a basic oral health survey is stratified cluster sampling. Another Viva question, it is a combination of stratified and cluster. So you divide the population into clusters and proportionately from you pick up the clusters, and that is called as stratified cluster sampling. It is also a method of probability sampling. Now there are two forms that WHO has recommended to use for collecting information for basic oral survey. Okay, I'll just show you these forms. You need not know about them in detail, just be oriented with the forms. So this is the basic oral survey form of 1997, and this is the one which is most commonly used. And as I told you, everybody uses this form to record. It is easy for comparison. It ensures uniformity. So this is 1997 form is such a big form which has around 180 variables to be filled. Okay, and you need not know that in detail. You need to know what all are there in this form. You have a general information. You have, that is your name, age, gender, ethnicity, all that. Then you have extra oral examination. You have temporomandibular joint examination. You have oral mucosal examination. So these boxes are, if at all the patient has lichen planus, you put the number 3 here. Then if the patient has that lichen planus in the buccal mucosa, you put 3 here and 4 here. So this is all codes which are given. Okay, so fill the codes accordingly. You have to measure enamel opacities and hypoplasia. There is an index for measuring dental fluorosis. There is an index for measuring periodontal status in terms of CPI index and loss of attachment. Then you have dentition status. This measures your hard tissue examination. KDs or any extraction is required, or a missing tooth, sealant is required, bridge is required. All these are measured using dentition status and treatment needs. And then you have prosthetic status. You have prosthetic need. Then you have orthodontic index. This is called the dental aesthetic index for dentofacial anomalies. It tells you what is the need for orthodontic treatment, and then any other immediate care and referral is required. So all these are cumulatively recorded. It is a 180 variable form, and this includes a complete overall assessment of the patient's overall health. And this was later modified in the year 2013. It is a shortened version of this, but the most commonly used one even now is the 1997 version. So 2013 version has similarly general information. Directly go to the dentition status, the periodontal status. It is a full mouth index here. Okay, and then you have loss of attachment, you have fluorosis, erosion, dental trauma, other mucosal conditions, dentures, and so that is how you record the WHO Oral Health Assessment Form 2013. So either of them can be used. These are all standard forms, and the use of these forms will enable comparison among population. So that is where we end this topic on survey procedures. These are the questions you can expect from this topic. Define survey, write in detail the steps in survey. Then short essays on sampling techniques. Then probability and non-probability sampling methods in India separately. What are the different types of surveys? In short notes, you have WHO index age groups, different types of examination, that is type 1, type 2, type 3, type 4. What is pathfinder survey and pilot survey? What is training and calibration? Validity and reliability. And very rarely you can expect a question on basic WHO Oral Health Assessment form, wherein you need to just elaborate on what are the headings that come under the 1997 and 2013 form, and what is the main intention of using such a form for conducting oral health assessment across the globe. Okay, so with that we finish the topic on survey procedures. So that's all for today. Thank you.